Hi there, my name is Dr. Shannon Vanderdolen. I am a naturopathic doctor. I have a focus in hormonal health, fertility, pregnancy, and postpartum care. And today I want to talk to you about how endometriosis can be diagnosed. So, March is Endometriosis Awareness Month. I have a previous video about kind of what endometriosis is, some of the causes and the symptoms. I also have another video, which I'll link below, talking about just painful periods in general. And certainly, endometriosis is probably one of the most common, I think it's the second most common cause of menstrual cramps in women. And as a naturopathic doctor, one of the main kind of like tenets of the medicine that I practice is I want to try to understand the underlying cause of someone's symptom or condition. And often that means like we have to be doing a pretty thorough assessment to really understand what's going on for this person. So when I have a patient in my practice who's either dealing with really brutal menstrual cramps or pelvic pain, certainly endometriosis is one of my what we call differential diagnoses, meaning it's like one of the things I'm thinking about that could be going on for this person. And the other thing, or the other main condition I support women is their fertility. And again, endometriosis is definitely coming up. It's often diagnosed for people for the first time after they have been experiencing infertility or they're struggling to get pregnant. And then at that point in time, they finally do get diagnosed with endometriosis. So these are kind of the things that are going on in my practice where I start to think about endometriosis. But sometimes, it's kind of been thought that it's a tricky condition to diagnose, and that, I was taught when I was in school, and I've heard from my healthcare providers, we always talk about this gold standard of diagnostics. And in endometriosis, the gold standard is something called a laparoscopic surgery, right? So they're taking cameras, inserting them into your abdominal cavity and your pelvic cavity laparoscopically, so making some small incisions in your abdomen to literally look in the pelvic cavity, in the abdominal cavity, to see, do we see this growth of endometrial tissue in this person's body, right? So that's obviously an invasive procedure. It certainly has risks associated with it, not just the procedure itself, but having the anesthetic and the whole 9 yards, risk of infection, that type of thing. And third, while we don't think about this a lot, it is costly to the healthcare system, right? To have people undergoing a surgery to get a diagnosis. The benefit of that surgery, however, is that if endometrial tissue is found, the doctor or the surgeon will often remove the tissue. So it's kind of like a diagnosis and a treatment combined. Again, that's a complicated thing to get into. I won't talk about necessarily I'm not a surgeon either, so I don't want to talk about all kind of the surgical techniques, but it is kind of a 2-for-1 in that sense. So if we're suspecting endometriosis, you have that surgery, it often is treatment as well at the same time. So coming out of that surgery, a lot of women will find they have a reduction in their pain and in their symptoms overall, because some of the tissue that has been contributing to that pain has been removed, which is great. So, I was always taught and always under the assumption, and when I've been going to my practitioners over the years to say, I'm having these really brutal menstrual cramps, the conversation was always like, well, it could be endo, but like, we're not going to send you for surgery to diagnose you, right? It was kind of always like, that's like a last resort for people who are really struggling and can't cope. And that's the only way we can really diagnose this condition. And more, we're coming up with and looking at the research to say, we actually can use some other less invasive tools in our toolkit to diagnose this condition. So I wanted to go through what those are and help you as a potential person wondering if you have endometriosis, to help you advocate to have these tests done. So one of the first things that a doctor will probably send someone for is something called a pelvic ultrasound. Sometimes that's also called a transvaginal ultrasound. And essentially they're using an ultrasound imaging tool to look at the uterus, the fallopian tubes, the ovaries, to try to see if we can see any endometriosis. Now, that extra tissue that might be deposited throughout the pelvic cavity or the abdominal cavity might not be picked up on that ultrasound, but there are things that might be identified on the ultrasound, things like ovarian cysts or torsion of the fallopian tubes, or other growths potentially, or changes in the structure that might indicate endometriosis is more likely, as opposed to someone if like their pelvic ultrasound is completely normal, like there is no abnormality found, then we might be thinking, okay, maybe this is a little less likely to be endometriosis. There have been studies that have looked at, when women were scheduled to have surgery done, so we knew they were going to have surgery, ultrasounds were performed, and they can correlate on the ultrasound to see actually, like if we look at all these different criteria on the ultrasound, we can actually predict with pretty like good certainty how severe that endometriosis will be when we go in laparoscopically. So that's really interesting to know. It does take pretty precise ultrasound technique, so we do need to rely on our ultrasound technician being competent. And that might be where the conversation with your doctor comes in, is to, maybe you are having your ultrasound done at a hospital setting if that's available to you, as opposed to like an outpatient ultrasound clinic, right? Where maybe the radiologist at the clinic might have that higher level of training and technique to be able to use this tool, this diagnostic tool, more effectively. Secondary to a pelvic ultrasound is an MRI. So again, you can have a pelvic MRI done. Again, this is, a little bit more on the invasive scale, in the sense that, it is exposure to, radiation. We have to keep that in mind every time we do an imaging test. It is a little bit more costly to the healthcare system, but again, it's going to be a little bit of an added layer of precision and accuracy when we look at the imaging. Again, there is very specific markers. I'm not a radiologist or, a technician, so I can't speak to what those are exactly, but we seem to be able to diagnose or look at certain things that we see on the ovaries and in the uterus, the fallopian tubes, and maybe elsewhere in the pelvic region, to say, what that looks like endometriosis. And if we can correlate it clinically, then that person might actually get the diagnosis they need without needing to use the laparoscopic surgery. A third tool that's not surgery, or a third non-surgical tool to look for endometriosis, is actually a blood test. And this is something that I can access in my practice as a naturopathic doctor. And I do run this test every once in a while when we're really not getting access to the testing we need through, our funded healthcare system. I unfortunately can't order MRIs and ultrasounds in my practice, but I can order this blood test. So this blood marker is something called CA125, or cancer antigen 125. That sounds a little bit scary, and for good reason. It is also a marker of ovarian cancer. So if someone has very high elevated levels of CA125, we are starting to think about ovarian cancer. There's a certain kind of sub-threshold where the levels are elevated, but not very elevated, that can actually indicate endometriosis. The trick with this test is, if we have someone who has symptoms and we run the test, if it's positive or elevated, we can say, again, with some certainty, that endometriosis is pretty likely. So again, that's where I would say to someone, yes, you have endometriosis because your CA125 level is elevated within this range. However, if we have someone who has symptoms and we run the test and the test is negative or normal, it doesn't rule out endometriosis. And it can also be something that we use as a monitoring tool. So let's just say, for sake of argument, if someone's CA125 level was at a 50, after a couple months of us doing treatment and working together to bring down, levels of inflammation, to support overall health, reduce pain, we can actually remeasure someone's CA125 level, and we might actually see that the level has gone down as the severity of the disease has improved, right? So we can see that we're having less expression of the CA125. So it's another way we can monitor treatment to kind of make sure that we're on the right track. So in terms of kind of helping you advocate for yourself with your doctor, certainly some questions to ask. If you are someone who has menstrual pain or painful periods, all the symptoms we outlined in my last video, or you're struggling to get pregnant and wondering if endometriosis might be the reason why, a few questions to ask your doctor. One, and I think at baseline, is to say, can you please send me to have a pelvic ultrasound done? And again, depending on your jurisdiction or where you are, potentially having that procedure done at a hospital setting, where we know the techs at that hospital are going to be a little bit, potentially trained in a little bit of a different way, and that diagnostic precision will be a little bit better. You can also, depending on the results of that ultrasound, potentially request to have a pelvic MRI done, again, to kind of rule things in further or rule things out further, depending on the outcome of the ultrasound. And finally, speaking with your medical doctor or your naturopathic doctor to have the CA125 blood test run. Again, just to kind of give you some more information and data. As we talked about in the last video, I'm really a big advocate for getting a diagnosis. So while someone can have symptoms and we say, yeah, maybe it is, maybe it's not, I think knowing what you have, knowing your condition, knowing that you have endometriosis in a, as confirmed a way as we can confirm, really allows us to make appropriate decisions, A, about our treatment, B, about our fertility options, and kind of expected timelines around trying to get pregnant, and, essentially see like how we choose to live our life, right? And I think all of that stuff comes together and really is just a piece of like you being an informed person about your health. I think it's information that you absolutely deserve. If you have any questions, concerns, please feel free to reach out to me. You can leave a comment below, you can send me a DM, or feel free to go to my website, www.shannonnd.ca. If you click the Get Started button in the top right corner, you can book a complimentary meet and greet visit with me. We can kind of discuss your unique situation, what you have going on, and discuss if working with a naturopathic doctor and working with me in particular is a good fit for you. Thank you, as always, so much for watching. If this is something that resonated with you, please feel free to like and share with your friends. Share with someone who might really value this information. That's my goal. I'm really just trying to get information to everyone's hands. Okay, take care.